I get it. Nobody likes to be in the hospital, but this is how you make it out alive. As a medical doctor that's worked in the hospital for the past 15 years, there are 4 tips you want to have in your arsenal so that if you go to the hospital, you come out better than when you went in. Let's go. Number 1, I need you to know everybody that's talking to you. Ask their name, know their specialty, their department, what role they are playing in your care. Take a card, write it down, okay? Here's the thing, you're going to be interacting with a lot of people in the hospital, and you need to know what role everybody's playing. If the radiology tech come in and start telling you about how to take insulin, I mean, that's cool, but you want to run that past the person that's actually managing your insulin. If the gastroenterologist or stomach doctor starts talking about your foot wound, ask questions. It also helps to eliminate confusion, helps you keep track of who's who, and it helps with accountability. Because I guarantee you, when you ask who they are, they know you were serious. Number 2, repeat your story again and again and again. I get it. Nobody wants to be telling their story over and over and over again. You done told the story to the ER doc, then the hospital doc, then the specialist, and now each nurse that comes on the shift. But here's the reality. You do not want people playing telephone with your health history because your story will be morphing from person to person to person. And I guarantee you, eventually it will become inaccurate. It is better that you tell your story from your mouth to each provider who is taking care of you so that they have the right information. I know you're tired of saying it, but this is how you eliminate mistakes. And everybody is there for you, technically. You the star, time to shine. Next, ask questions. What's that? Am I supposed to be taking that? Am I going over there? Which leg you about to cut off? My right leg or my left leg? You need to know because this is care that is happening to you and your body. Advocate for yourself. If you feel clueless or in the dark about anything, speak up. If you've heard something traumatic and you need it repeated, ask. It should not be a problem for anybody, any specialist, any physician, any provider to repeat what they have just said to you. Because I guarantee you they would expect the same if they were in your shoes. Don't feel bad about asking questions. Have friends and family members at the bedside. I cannot tell you how valuable this is. It's not only valuable to you, it's valuable for your care team. Sometimes it will be the family members that say, he's a little off. This is not his typical self. I know he's saying he's okay, but he's not. It'll be those family members and friends. They'll say, is his face kind of drooping to you on this side? And normally he can eat without choking. This is abnormal. I cannot tell you how many times family members, friends, visitors have come in for the win. Also, it's an extra pair of eyes that's just watching and making sure everything runs smoothly. Not to mention, when you're hospitalized, you are not optimized. A lot of time you are out of it. You're not able to even ask the right questions or give the correct history. Have somebody there that can help you do it. Man, I can go on and on. Do you want more?